Hi, I'm Jennifer, and I'm going to be your student nurse today. We're going to do a head-to-toe assessment.
Okay.
The equipment that I will be using are my stethoscope, gloves, hand sanitizer, and pen light.
Okay.
First, I would like you to state your name, date, and where you are.
Jodian Hartley, 4/24/16, and I'm at home.
Okay. Patient is awake, alert, ×3. Also, do you use any assistive devices?
No.
Okay. Do you have any pain from 0 to 10 today?
0.
Okay. Patient has no pain. I'm just going to assess your skin.
Okay.
Upper body, no lesions. Skin is warm to touch. Sorry, my hands are full. I'm going to do turgor. No tentin. Color is appropriate for patient and is dry for appropriation. Alright. Just make sure. So now I'm going to do hand sanitizer. I'm going to assess your head.
Okay.
I'm going to put on gloves. Patient has no dandruffs, no lesions, hair is appropriate color, scalp is appropriate, and now I'm just going to palpate. There's no lumps. Now I'm going to check patient for facial functions. Can I have you raise your eyebrows, smile, frown for me, and puff out your cheeks? Patient's facial functions are intact. Can I have you open your mouth for me, please? And say ah. Okay. Thank you. Mucous membranes are pink, moist, no halitosis. Teeth are nice and clean. No tonsils. Uvula is midline and symmetrical with ah. And then get a pen light. Can I have you take one hand and hold your nose and breathe in? Other nostril. Patient has no problem breathing in and out. Do you have any trouble breathing?
No.
With smell?
No.
Do you have any pain when you eat or drink?
No.
Okay, can I have you swallow for me? Perfect. Do you have any problems with seeing?
No.
Okay. I'm just going to check inside your nostril.
Okay.
There are no lesions or drainage. Okay, so I'm just going to touch your eyes. I'm just going to put my hands sanitizer. Iris are brown. Scrotum is white. I'm just going to pull down.
Okay.
Conjunctiva is pink, no fluids or drainage. Eyebrows and lashes are even throughout, and they are there, the hairs. Okay, and then I'm going to have you follow this pen. And I'm just going to check. Perla. I just want you to follow the 6-point areas that I'm going to look this at. Okay. I'm going to do a whisper test, so whatever I say into your ear, just please repeat to me.
Okay.
Rice. Boy. Okay. And there's 3 words that I want you to remember. Fish, blue, and dog. Okay?
Yep.
Tell me when you can see my hands.
I can see them.
Perfect. So I'm just going to palpate your trachea. Okay.
Mhm.
Can I have you move your head side to side? Up and down? Perfect. Accessory nerves are all intact. I'm just going to check your cardiac artery. Both are strong, 2 plus, equal bilaterally. I'm going to check your ears. Okay. Patient has no lesions. Now I'm going to just touch them.
Mhm.
Dry. They're moist and warm. They're warm to the touch. Just going to check inside. No drainage or buildup of wax. Okay, so now I'm just going to palpate your pericardium. And there's no masses felt. And I'm going to listen to your heart. S1, which is located on the fifth intercostal space, and the S2 is located on the second intercostal space. S1 and S2 sounded clear with no murmurs and no extra sound. Okay, so now I'm going to have you, can you just take for fine motor, can I just have you take your fingers and touch each one with your thumb? Perfect. Patient's fine motors are intact. Now I'm going to listen for your lung sounds in the back.
Okay.
Every time I touch, just deep breathe in for me. Lungs are clear bilaterally equally throughout. I'm just going to have you go to the front. Yes. I'm just going to palpate your sinuses.
Okay.
Let me know if there's any pain or tenderness.
Okay. No.
Patient reports no pain or tenderness. There were no lesions and no crevices and no lumps. So now I'm going to palpate the arterial lung sounds. Breathe in. Lungs are clear bilaterally throughout. Next, I'm going to have you just raise your arms for me and rotate forward, rotate backwards. Then can I have you take both of your arms and bring them forward, bring them down. Patient's range of motion is fully in motion. So I'm going to have you push up against my arms and push down now. Patient's strength is 5 out of 5 for upper extremities. Okay, so now I'm going to have you walk for me. Patient is not swaying side to side. Patient's posture is erect. Can I have you lift up one leg? Now the other leg. Patient's gross motion motors are intact and patient's balance. Can I have, I'm going to do the rhombic test. Can I have you stand straight? Patient is not swaying side to side. Balance is good. Okay, so then I'm going to check your spine now. So I just need you to bend forward. Patient's spine is aligned. There are no curvatures, no sign of scoliosis. You can stand. All right. Next. I'm going to check both of your pulses, your radial. Both are equal bilaterally, plus 2 plus. And then chest is symmetrical when breathing. That's what we're going to do. We're going to, all right. Okay, so I'm going to have you sit down. I'm just going to check your TMG. Can you open for me? No crevices were heard. So, is it okay? I'm just going to have you now straighten out your right leg and down. No crevices heard. No crevices heard. Was there any pain?
No.
Did that? No pain? Okay. Can I have you rotate your wrist for me? No crevices present. No crevices present. Was there any pain?
Mm-mm.
Okay. Can I have you do the rotate your ankles for me as well? No crevices present. I'm going to palpate your posterior tibialis. Equal bilaterally, 2 plus, and now I'm going to do your dorsal pedis. Equal bilaterally, 2 plus. I'm also going to check the skin on the lower part of your body. Skin is moist and warm to touch. No tension trigger. I'm going to check your capillary fills. Both under 3 seconds. I'm going to check your toes as well. Both under 3 seconds. I'm just going to use hand sanitizer. Okay. I'm going to check for lymph nodes. No presence of lymph nodes, which indicates that patient has no inflammation or infection, and the thyroids were unpalpated. That means there's no inflammation. Next, I'm going to have you lay down, and I'm going to check for abdomen sounds and bowel sounds. Abdomen has no lesions, and skin looks nice and clear. Sorry. Bowel sounds are active in all 4 quadrants throughout. I'm now going to palpate. Let me know if there's any tenderness or pain. Patient reports no pain and there's no masses. I'm also going to do vascular. Vascular sound clear throughout. And you can sit up again. Can you remember? Oh, also I'm just going to do 5 touches, so if you could just close your eyes.
Okay.
And wherever I touch, just let me know, okay?
Yep. Right shoulder. Left hand. Left foot. Right foot. Sorry. Right hip.
Okay. Did you have any questions for me? No. No? Do you remember the 3 words that I told you at the beginning?
Yeah. Blue, fish, and dog.
Yes. Thank you.
Yeah.